So essentially what we're doing in our trial is testing a very simple intervention in patients that have to come to the hospital because they've had an event in their heart, a cardiac ischemic event that requires treatment. So whenever a patient arrives, whether they've had a heart attack or whether they have had some pain caused by cardiac problems, patients are investigated by the cardiologists, and they're investigated by imaging the heart. So the cardiologist needs to see where the problem is, and they use sophisticated techniques called MRI. But to be clear about which blood vessels in the heart might be blocked, they have to inject a substance called contrast. This contrast essentially increases the ability to visualize the arteries that perfuse the heart. Using that contrast, the cardiologist can clearly identify which arteries might be blocked and which require treatment with a balloon or with something called a stent, which is a ring that is placed in the artery to prevent it from becoming blocked again. The problem with contrast is that it is absolutely necessary to image the heart, but it also has some impact upon the kidney. At the moment, there is no way of avoiding the use of contrast, and so clinicians, researchers are looking for ways to reduce the damage that is caused by contrast on the kidney. We're investigating this simple intervention called nitrate. Nitrate is something actually that we all consume in our diet. It's found in all vegetables, but particularly in green leafy vegetables. In our study, we're giving patients a nitrate pill or a placebo. Patients don't know which one they're getting, and neither does the cardiologist or us researchers, but we give this pill before the contrast is given, and then for the next 4 days after. And then we take blood samples. We also ask the patient how they're feeling using a questionnaire, and we're measuring markers of kidney damage in the patients. We see them again 3 months later, and we measure the markers again for kidney damage. Our hope is that this simple intervention might actually reduce any of the damage caused by the contrast on the kidney, and thus make outcome for the patients